thousands of patients of blood cancers, thalassemias, whose only hope is having a bone marrow transplant, that is a stem cell transplant. They have to get their stem cells from a donor.
Thalassemia major is a huge public health problem in India because we have over 10,000 new births of thalassemia major and also a similar condition which is sickle cell anemia. So both these are red blood cell problems and they are genetic. Thalassemia major requires monthly lifelong blood transfusion. So as soon as we make a diagnosis, we start transplant counseling early, and the only curative option that families have is to do a bone marrow or blood stem cell transplantation. Only 30% of our families have a fully matched donor within the family who can donate their bone marrow to help cure this child. And the rest 70%, they would benefit from the transplant. We begin searches in unrelated registries worldwide.
People of Indian origin will have similar HLA types, and therefore a patient of Indian origin is more likely to get a donor from amongst Indian people rather than from outside of India.
The whole process of transplantation is almost like creating a new beautiful garden full of roses. So first thing we need to do is prepare the soil and make sure it's healthy before we plant the seeds or grow the new plants. So the patient's own bone marrow stem cells have all need to be brought down to zero before they can receive the new stem cells. Their immune system also needs to be brought down to zero so that they will be able to receive the new stem cells. So the patients are going through really difficult treatment.
You may be the only person out there who could be the second chance at life for this patient. Please come forward and join the registry. But when you join, you must remember it's a pledge, it's a promise. You could come up as a match several years later to some patient out there. And when you're called to donate, it is at that time you're the only person who could save this life.